because it is very important that we find a Missouri solution. The Obamacare has caused a big hole in our health care for those who are needy, between $10,000 and $38,000 in income. We need to find a Missouri solution, because these families, if they can't get health care, they can't get the benefits of the preventive care that parents as teachers advocates, and too many of these families are going to go without. And on top of that, in rural areas, you're going to find that qualified healthcare professionals are being poached. They're being offered better salaries in states where they have expanded it. With Missouri's structure, the Medicaid in Missouri only goes up to $10,000, and Obamacare only kicks in at $38,000, so you could get in the exchanges and get a subsidy. So families who are working families who don't make $38,000 but make more than $10,000 are left out. And that's why we've got to find a Missouri solution and implement it in this coming session of the Missouri General Assembly. Well, the other states who've expanded Medicaid have been able to steal our healthcare professionals away. I can't be a mind reader, but I think there are some conservative senators who think it's part of Obamacare, and that's not what we're talking about. Obamacare caused the problem, and for conservatives, we need a conservative solution to the Obamacare problem. Quite simply, with the Ryan-Sylvie bill, we've set it up so there will not be any hit to the general revenue budget. Well, I understand why there's no trust in the federal government, but having the federal government try to go back on their agreement would be, I think, very unusual, and would have a totally different bunch of cats up there than the ones I'm used to dealing with in the House and Senate. Well, there's a lot to be said for that. Medicaid, unfortunately, in Missouri and many other states is dysfunctional. But that's one of the reasons that we are calling this Medicaid transformation, because we're going to change the way Medicaid operates in Missouri for the new people coming on. I think it is very important that we enlist the parents as teachers, educators, and parents as teachers' families in talking to their legislators about the importance of Medicaid reform. It's reform. It's conservative reform. It won't bust the budget. It will take care of the needy, not the greedy. And the best things, particularly visiting with senators, but visiting with House of Representative members and senators, you can ask them where they stand and tell them that to take care of the people who are working families with $10,000 to $38,000, you've got to provide them health care. We've got to keep qualified health care professionals in the state. We've got to make sure that we get rid of the fraud and abuse in the program. This will bring money to the state. It will keep our families healthy. Mothers will be, women will be able to get breast cancer screening. We will get the preventive care we need for children so they can learn. This is, I think, right in line with what parents as teachers has always preached. And that's why I want my friends and parents as teachers to help join our coalition. I just talked today with a representative of the one of the veterans groups, and we will be meeting with the coalition of veterans groups, because 40,000 Missouri veterans and their family members fall in that donut hole, and they can't get health care. And we also are working with the Farm Bureau because Farm Bureau families come from rural areas. And those of us who've come from rural areas know that when they cut the doctor's staff, cut the community health centers, we are without access to to good quality health care. And we would like to have parents as teachers and all of the members and families who are involved join with us in urging their senators and representatives to support Medicaid healthcare transformation. Representative Ryan Silvey's bill, it may be changed a little bit, but that's basically what the legislature will work on. Thanks to parents as teachers for giving us the opportunity to tell the tremendous network of wonderful people involved in parents as teachers why it is important for them to take steps now to make sure Missouri moves forward with Medicaid reform.